Hartman, physician assistant, exercise science specialist, and health coach at ironmedicinepa.com. Today I'm bringing you my second part in my series on controlling glycemic variability in type 2 diabetics. Today we're going to be talking about my favorite subject, exercise, and why it's important and how we can utilize this for diabetics. So there is a consensus here. Diabetes can be stopped with intensive lifestyle change. I think most of you all know that. We're going to go through the research here and look at interventional studies and seeing how quickly diabetes can be reversed. So they did the Finnish diabetes prevention study. It was a pretty cool 3-year intervention in lifestyle on diet and physical activity. There were 522 middle-aged overweight subjects with impaired fasting glucose, and they were randomized to either usual care or intensive lifestyle change. Now, the intensive lifestyle change was quite resource heavy. They needed to hire exercise science specialists, they needed to hire nutritionists, and these patients would go one-on-one with these people a couple times a week. So a bit expensive, but they had great results. Unfortunately, after the trial ended, these patients went back to their old usual habits. Unfortunately, they went back to being diabetics. So let's look at other studies. And that's going to be the consensus for all these things. Yes, it can be done with intensive lifestyle therapy, but if you don't stick with it, you're going to go back after the study is done. One kind of easy one I came across was exercise after breakfast. What they did here in this study was to show the significant glucose-lowering effects of a postprandial exercise. And I think these patients just did a simple walk after breakfast. They observed a 21% reduction use of metformin, and the magnitude of exercise-induced postprandial glucose reductions was comparable to that of hypoglycemic agents traditionally used for reducing postprandial glucose, such as Actos, which I've talked about before, not very common to use that one. Other ones like glipizide, and other ones like Tragenta. So pretty easy to do, really cool study. A simple walk after breakfast helped these diabetics sometimes even get off their diabetic drugs. Let's see, effects of exercise and caloric restriction on insulin resistance and cardiometabolic risk factors in older obese adults. So this is a key study here. They're actually reducing the calories, and not all these studies here will do this, so this is one to take note of. These patients, let's see, 24 participants, 9 males and 15 females. You may say that's a very small number, but because these are interventional studies where they measured them before, then put them on a regimen and saw the results during the regimen and afterward, it actually is quite significant. We like interventional studies here. So they were average age 65, sedentary, had impaired fasting glucose and metabolic syndrome. That means hypertension, high cholesterol, diabetes, overweight. They were randomized to exercise or exercise combined plus a 500 kilocalorie reduction in caloric intake. The exercise training consisted of walking on a treadmill or a cycle, starting at 60% of their heart rate max and increasing it over the weeks. For about 12 weeks they did this. So both groups experienced significant weight loss, but the reduction was greater in the exercise plus caloric restriction. Obviously, we can assume that. Both interventions improved insulin sensitivity and indices of metabolic syndrome, systolic, diastolic blood pressure, waist circumference, glucose, triglycerides. Really cool stuff. So these data suggest that exercise alone is an effective non-pharmacological treatment strategy for insulin resistance. So you don't even need to cut calories to see an improvement in diabetics. But if you do some calorie cutting as well, just added benefit. Let's look at another one here. Normal exercise with a caloric surplus. So very interesting. So these patients were eating more than they should have. A caloric surplus means that you could gain weight by eating. So healthy individuals on a high caloric intake were randomized to either 10,000 or 1,500 steps a day for 14 days. So these were healthy individuals, not diabetics. So we're like, wait, what? You can't surely measure changes in just 14 days. Well, let's look. Both study groups gained the same amount of body weight. However, the inactive group accumulated significantly more visceral fat. Now, why is that important? Because visceral fat, as I've discussed previously, is now being known as an independent risk factor for all-cause mortality. So pretty important. So what did they find here? Let's see. In addition, our findings strongly support the common recommendations on daily physical activity, at least 10,000 steps a day. Because these patients who did the 10,000 steps didn't gain that visceral fat. Pretty cool. Let's see what else we have here. The effect of acute exercise on endothelial function following a high-fat meal. So many arguments are made sometimes by vegan practitioners and sometimes regular and mainstream science that low carbohydrate, high fat diets, which oftentimes diabetics use to help control their blood sugars, are deleterious because of the high saturated fats. Now, saturated fats is a whole nother subject, but we can look at a brachial artery index. So it's how well the blood flows in the arteries. And we can see that a simple bout of aerobic exercise, that means walking or treadmill or biking, can not only counteract the postprandial endothelial dysfunction induced by ingestion of a high-fat meal, but also increase the flow rate. So that's pretty cool. We can offset some of the theoretical problems with a high-fat diet if we combine it with some exercise. Let's see what else we have here. So 3 times a week, randomized control trial of resistance exercise training to improve glycemic control in older adults with type 2 diabetes. So they did progressive resistance training. So that's basically going to a gym, seeing a personal trainer, and making a plan to build your muscle. So increasing the resistance over time. And they did this for 16 weeks in this trial in 62 older Latino adults. And they found that doing this reduced their A1C from about 8.7 to 7.6. It increased muscle glycogen stores. So this means how much, say we eat a carbohydrate meal, how much of this is taken up into our fat and how much of it is stored in our muscle to prepare us for our next bout of exercise. So a smart body, a body that's not in dysmetabolism, metabolic dysfunction, it can utilize carbohydrates stored in your muscle and use it for the next bout of exercise. In dysmetabolic individuals, eating a high carbohydrate meal or eating just any sort of sugars, sometimes that spikes the blood sugar and it floats around in the bloodstream and causes endothelial damage. These are dysmetabolic people. But we showed here that perhaps utilizing a progressive resistance training program can train the body to store that glucose, that carbohydrate, as glycogen again, as it should. And let's look at another one. Twice weekly progressive resistance training decreases abdominal fat and improves insulin sensitivity in older men with type 2 diabetes. And this is so important to note because we always think of the young bodybuilder, meathead, pushing weight in the gym. Oh, it's not for older people. False. These studies are showing that older people need to be in the gym. They need to be building muscle. Maybe not because they're going to get up on a bodybuilder stage and get all oiled up and tanned. No, it's because they're trying to prevent or reverse diabetes. And these men, they showed that their visceral and subcutaneous abdominal fat decreased significantly by 10%, while no changes were observed in BMI, so body mass, and that's so critical. If you get up on the scale at your doctor's office and they weigh you and they measure your height and they tell you your BMI is this, that doesn't tell you what your visceral fat is, meaning the fat on your organs, which, as we've alluded to, is an independent risk factor for all-cause mortality and causes increased inflammation. So this is my favorite topic, so I like talking about this a lot. I was a personal trainer myself. I studied exercise science in college. You have to, if you've never started before, I recommend getting a personal trainer. Talking to someone at your local gym who's an expert in this, who can guide you through creating a program, learning the machines, doing it safely. I mean, everyone's going to have limitations. Maybe you got some flexibility problems. You need to learn, ins and out of this. You can't just go in there and just start pushing around a weight. You need to have a plan, and there's people out there who are experts and who would be willing to guide you in this. So many studies show a good metabolic effects of 2 to 3 times a week training, alternating muscle groups. You can do a push, pull, upper day, a leg day. You always want to start out with a lightweight and warm up, do some dynamic stretching, so range of motion exercises, and a personal trainer will go over that with you. Here's an example of a program I would build for, a 56-year-old African-American lady with diabetes, hypertension, she was overweight. Actually, this is someone I knew back in the day, and I created a program for her. And this is kind of what it would look like, the day, the plan, how much she was doing, the reps. We try to do always 8 to 12, so she would document how many she was doing, and she would put in how much weight she was pushing and how she felt on these exercises. Some days she couldn't because her joints hurt too much, so we couldn't do some exercises. Then we adapt to that. So recovery, you will be sore, and I hear a lot of patients complaining about the soreness. There's a couple ways to prevent this, and it does not include taking ibuprofen or painkillers. I heard this one guy at the gym telling me, as if it was a big secret, oh, you know the way you prevent DOMS or delayed onset muscle soreness? Yeah, take an ibuprofen after the workout. And I was like, oh man, where'd you learn this? This was kind of like the bro science talk at the gym, and this is an older gentleman who shouldn't have been consuming ibuprofens. And I said, hey man, you might want to talk to your doctor about that. That doesn't sound right. You should get your kidneys checked, because it can cause kidney damage if you consume ibuprofens on a regular basis. And it even can prevent muscle synthesis, theoretically at least. And I have a presentation on that I can do at some point. You want to consume adequate protein intake. Some say at least 1 gram per kilogram of body weight. I would say perhaps even 1 gram per pound of body weight. So for myself, 175 pounds, I'd probably consume at least 90 grams of protein a day. I'm more towards hitting 150. I'm trying to get up to at least 170 grams of protein a day, 175 if I can. And there are studies monitoring renal function diabetics. So the effects of high protein diets on kidney health and longevity showed that some patients may have worsening of renal function on a higher protein diet. There are several studies that correlate a more vegan-based diet on improved renal function. Again, I would be hesitant to jump to conclusions that vegan diets are better, since there are too many variables that aren't taken into consideration in the quality of lifestyle and the quality of diet in these studies. Obviously, vegan diets would have a lower protein intake and a lesser quality protein intake. So the protein quality matters. Making sure you're getting the right protein sources with the right amino acids will be key. And we can talk a little bit more about that in another lecture. So let's make some conclusions. Something you can do long term is important. I mean, that's the key with all these studies. If you can't stick with it, it's not going to work. Exercise after breakfast, I feel like that's a really easy one to do. If you do consume breakfast, like myself, I don't actually consume breakfast. I do intermittent fasting, so I only eat twice a day, so lunch and around the evening time. But if you do eat breakfast, you want to do a walk afterwards, or maybe after your lunch or your dinner, you go for a little walk, and that will help control that glycemic spike, especially if you are in the diabetic spectrum. Don't feel bad if you hit a caloric surplus during the day. You can just walk it off, and studies do support that. A progressive resistance training program reduces A1C and gets patients off hypoglycemic agents. Don't worry if your BMI isn't changing while on a program. Your visceral fat is, and it is more important. The BMI might change eventually, but the visceral fat is probably the first one to change. Exercise allows the blood flow in your arteries easier, and it is suggested that exercise can buffer the theoretical side effects of a high saturated fat diet. And progressive resistance training programs will need to be individualized to the diabetic patient. I always recommend getting a personal trainer and talking to an expert like that. Hope you all enjoyed this lecture. The next one is going to be more on nutrition in diabetics and controlling glycemic variability. I will see you next time.